Now at 11, the FDA could soon approve another COVID-19 vaccine for emergency use. If that happens, the single-dose Johnson & Johnson vaccine could be distributed across the country as soon as next week. And that could determine when Indiana expands vaccine eligibility to the next group, Hoosiers 50 to 59 years old and those with one of 6 medical conditions or circumstances.
And that includes anyone 16 and older with sickle cell disease. WRTV's Cornelius Hawker shows us why the vaccine is so important to those with this common lifelong blood disorder.
Almost a year into this pandemic, and many of us are navigating this new world just fine, wearing masks and social distancing whenever we want or need to do something outside of our home. But for people like Lena Harvey, who has sickle cell disease, that's not been the case.
I'm just ready to resume some sort of normalcy so that I can get back to fully being, the wife, the mom, the advocate that I am.
Casual trips to the grocery store or a restaurant have been a no-go for Lena.
I have been at home all year since this started. I have been here making sure that myself and my son especially are safe from the coronavirus.
Sickle cell disease impacts red blood cells, which carry oxygen throughout our bodies. Those with sickle cell have a higher chance of ending up in the hospital and dying from the virus, according to the CDC. Dr. Emily Meyer, a sickle cell disease specialist where Lena gets treatment, the Indiana Hemophilia and Thrombosis Center, explains how dangerous it is for someone with sickle cell to get COVID.
The thing we worry about most with COVID infection is that it can cause long-lasting lung disease, and lung infection cause trouble with the heart, something called pulmonary hypertension or high blood pressure in the lungs and the blood vessels of the lungs.
The list of things that can go wrong is long. That's why Dr. Meyer and Lena told me they're so excited to hear the state will soon allow those with the disease to get vaccinated.
I don't want to live my life cooped up any longer just because, I don't have access to a vaccine.
And for Lena, getting vaccinated and sharing her experience is even more important because studies have shown many Black people are hesitant about getting vaccinated, and both COVID and sickle cell impact African Americans at higher rates.
We have to put our health and our priorities first, and we cannot act on fear or, what has happened in the past. We can't allow that to keep pulling us back. It can't be.
Working for you, Cornelius Hawker, WRTV.
Sickle cell is a genetic disease. Symptoms can range from mild to severe and usually appear during childhood. When vaccine eligibility is expanded, we will keep you updated on air and through the free WRTV app.